Hello everyone, this is Clarice Joy de la Peña,
This is Catindoy,
and together we are the human chorionic gonadotrophin in action.
So hi, I'm a human chorionic gonadotrophin. And I have so many names. For example, my generic names are CG, hCG, DU, pregnancy urine hormone, chorion gonadotrophin, and gonadotropicum chorionic. My brand names are Corex, Novaral, Ovidral, Pregnil, and Prophecy. And my chemical name is human chorionic gonadotrophin glycoform alpha. My therapeutic drug classification is ovulation and spermatogenesis stimulant, while my pharmacologic drug classification is gonadotrophin. My pregnancy category is X, which means that if you use me, it may cause birth defects in the baby, so do not use me if you're a pregnant woman.
Now we're going to be talking about the mechanism of action of hCG. We have here the ovulation stimulant action for female and the spermatogenesis stimulant action for male. In the action of the ovulation stimulation, I mimic or act similarly to the action of the luteinizing hormone. The luteinizing hormone is a chemical produced by the pituitary gland that stimulates ovulation of mature ovarian follicle. So some fertility problems are due to a woman having trouble producing the luteinizing hormone. So since this luteinizing hormone stimulates ovulation and ovulation is necessary for pregnancy, well, if a patient is experiencing this, the hCG, can be of help. Next we have here is the spermatogenesis stimulant action. My primary action in the male body is to combat symptoms of hypogonadism, such as low testosterone and infertility. The hCG is used as a source of LH activity to stimulate the testosterone secretion by Leydig cells. That is why I can help the body to increase production of testosterone and increase sperm production, which can reduce infertility. Now let's talk about pharmacokinetics. I'm probably going to be sharing to you my travel path in the human body. So basically, we all know that pharmacokinetics is how the body affects the drug. So we have here absorption, distribution, metabolism, and excretion. First is the absorption. Technically, hCG must be administered intramuscularly into the gluteal buttocks muscle, or it can be in any allowed areas for IM injection that your doctor prescribes you. Once administered, the blood levels peak is within 6 hours. Second is the distribution. Primarily, I am distributed into the testes and the ovaries. So, as what I have said earlier in the mechanism of action, hCG stimulates ovulation and stimulates spermatogenesis. Third is metabolism. The circulating hCG in the human body is primarily metabolized in the liver. So I have an initial half-life of 11 hours and a terminal phase of 23 hours. Fourth and last is the excretion. I'm excreted in the kidneys together with the urine. That is all for the pharmacokinetics of hCG. Now let us go to the indications and discuss little examples of the dosages. We, the human chorionic gonadotrophins, are indicated for prepubertal cryptorchidism for children. What do you mean by that? It is a failure of the testes to descend into the scrotum of boys who have yet to start puberty. So, it is administered through intramuscularly, and the dosage is individualized based on indication, age, weight, and physician's preference. Next, we are indicated for the induction of ovulation and promote pregnancy. In adults, it is administered intramuscularly 5,000 to 10,000 international units 1 day after last dose. Next is hypogonadotrophic hypogonadism secondary to pituitary deficiency in males. In adults, it is administered IM and in 500 to 1,000 USP units 3 times weekly for 3 weeks and then twice weekly for 3 weeks. We are also indicated for spermatogenesis induction. In adults, we are administered through IM with a dosage of 1,000 to 2,000 units 2 to 3 times per week.
Contraindications. Contraindications are the opposite of indications. Contraindications may be a condition or factor that may be a reason why a certain medical treatment is stopped because it may cause harm to the patient. Human chorionic gonadotropin has many contraindications. For example, it is contraindicated to patients who are allergic to it, as it may prevent hypersensitivity reactions. It is also contraindicated to children with precocious puberty and androgen-responsive cancer such as prostatic cancer, testicle cancer, and male breast cancer, as the drug can stimulate the production of androgen. Human chorionic gonadotropin is also contraindicated to patients with asthma, seizure disorders, migraines, cardiac or renal diseases, thromboembolic disease, and thrombophlebitis, as it may be exacerbated by the drug. It is also contraindicated to patients who have adrenal insufficiency, ovarian failure, thyroid disease, and polycystic ovarian syndrome, as some patients who have polycystic ovarian syndrome are unusually sensitive to gonadotropins and may have an unusual response to ovarian hyperstimulation protocols.
It is also contraindicated to geriatric patients. The clinical studies of hCG for the treatment of infertility in women typically do not include a sufficient number of geriatric females. Another contraindication is pregnancy. Before administering hCG, check first if the patient is pregnant. It is because hCG can cause potential harm to the fetus, and also we can increase the risk of multiple gestation. Next is breastfeeding. Most endogenous gonadotropins are found in breast milk or tissues to some degree. It is either known whether exogenous hCG is distributed into breast milk or what effect this would lead to the breastfeeding infant. Next is obesity. So due to the lack of therapeutic effect and potential risk of therapy, the hCG is not to be used for the treatment for obesity. Number 9 is tobacco smoking. This may decrease infertility and the effectiveness of fertility drugs in some women or men. Patients should be encouraged to avoid tobacco consumption and pursue smoking cessation while pursuing fertility treatments such as hCGs. Last on our list, there's a lot of contraindications for hCGs, and these are only some examples for the cautions of or contraindications. So we have here the hepatic disease and renal impairment. So the pharmacokinetics, safety, and efficacy of human chorionic gonadotropin have not been established in patients with hepatic and renal impairment. So that is why it is contraindicated.
Along with its needed effects, human chorionic gonadotropin may also cause some unwanted effects. Although not all of these side effects may occur, it may also cause some medical attention. For example, for girls may experience bloating from mild, moderate to severe. It may also cause stomach or pelvic pain, abdominal or stomach pain, decreased amount of urine, feeling of indigestion, nausea, vomiting or diarrhea, shortness of breath, swelling of legs or lower feet, and rapid increase in weight. For boys may experience acne, enlargement of penis or testes. They may also experience rapid increase in height.
Okay, so my partner just discussed about the adverse effects for the female body and the male body. Now I'm going to be talking about the adverse effects per body system. So we have here, in general, these are the most commonly reported side effects. This includes rash, groin pain, loin pain, and fever. Next, in the central nervous system is headache, irritability, depression, mood changes, and restlessness. For the gastrointestinal system, we have abdominal discomfort, abdominal pain, acute abdominal pain, ascites, bloating, diarrhea, gastrointestinal symptoms, and nausea. Next is the genitourinary system. We have here large ovarian cyst, mild ovarian hyperstimulation syndrome or OHSS, mild to moderate enlargement of ovaries, ovarian cyst, painful breasts, severe OHSS, and unwanted ovarian hyperstimulation. For the respiratory system, we have dyspnea, hydrothorax, and shortness of breath. Next is in the integumentary system, we have rash, acne, redness, itching, and urticaria. In the cardiovascular system, we have bruising, edema, and thromboembolism. Lastly, we have the endocrine system. It may cause excessive androgen production, gynecomastia, and precocious puberty.
So, before performing nursing interventions, the nurse should first perform physical assessment to establish baseline data and to determine the effectiveness of the drug therapy and to check for the adverse effects. Next is to assess for hypersensitivity to drugs, and then assess for the mentioned cautions and contraindications to prevent any outward complications. Assess prepubescent males for development of secondary sex characteristics, and assess for and report excessive menstrual bleeding and irregular menstrual cycles, and any abdominal or pelvic distension or pain. And then prepare medication that comes with a vial of water and powder and mix it together with a syringe. And then lastly, make sure that the patient takes the medication on time and follow doctor's orders.
Let's jump to the nursing responsibilities during the administration of hCG. So we have here the information of how to do it, and I'm going to discuss it one by one. First, we have administer with an appropriate dose of hCG as indicated to ensure beneficial effects. Always remember to follow the rights in administering the drug so that you can avoid medication error, and also for you to provide the beneficial effects for your patients. Educate patient on drug therapy to promote understanding and compliance. So this is self-explanatory, and you can get it from here that it is important for you to promote understanding to the patient so that he can cooperate in his therapy. Next, teach the patient how to properly prepare and administer the medication at home for themselves. This is only if the patient is completely comfortable of injecting hCG on their own. Another is When a woman is receiving fertility treatment, it is important for a nurse to educate them that they should not miss a dose because the success of your fertility treatment depends on the proper use of this medication. For men and boys, it is important again for the nurse to explain to them that in administering their own injections, they cannot miss a dose. So, as soon as possible, or as soon as remembered, you should take it. Another important nursing responsibility is to conduct patient and family education. Take note about the following. Treatment for prepubertal cryptorchidism is usually started between 4 and 9 years. hCG can help predict whether orchidopexy will be needed in the future. When used for treatment of infertility, timing of coitus is important. Daily intercourse is encouraged from day before hCG is given until ovulation occurs. Educate patient and family members to report promptly onset of abdominal pain and distension. This is for ovarian hyperstimulation syndrome. Also include in the client education to make the patients report the physician if the following appear: axillary, facial and pubic hair, penile growth, acne, deepening of voice. Induction of androgen secretion by hCG may induce precocious puberty in patients treated for cryptorchidism. Tell them to observe for signs of fluid retention. A weight chart should be maintained for bi-weekly record. Report to physician if weight gain is associated with edema. Educate them also to report vaginal bleeding during treatment of corpus luteum deficiency, for the drug will be discontinued. Include also in the client education not to breastfeed without consulting the physician. Lastly, nurses should offer support and encouragement to patients dealing with low self-esteem issues associated with infertility. So this is a sensitive issue, and for patients having trouble with perceiving children, it is depressing for them. It is very depressing for them, and with encouragement and support, nurses can uplift patient and also can help to make their mental health better.
So after nursing interventions, the nurse should monitor patient response to drug therapy. The nurse should also monitor for adverse effects such as decreased amount of urine, indigestion, nausea, vomiting, or diarrhea, and also acne, discomfort, pelvic pain, and rashes. And lastly, evaluate the patient's knowledge about the drug therapy by asking the patient what is the drug name, its indication, and the adverse effect.